Okay, I think I'm going to make a start. Thank you all very much for coming to this second session for the World Happiness Report 2025. As you can see above my head is John Helliwell, set ready to go, joining us live from British Columbia. So we're grateful for John getting up early this morning to come and speak to us. After John, we'll also have Alberto Prati talking about the chapter on sharing meals, and then Kelsey O'Connor will be talking about the chapter done by the Statec team here in Luxembourg, which was looking at the effects of well-being and prosocial behaviour on deaths of despair. But let's begin with a large round of applause for John Helliwell.
Thanks, Barry, and I'm sorry I can't be with you in person. I'm with you in spirit. You've heard already from Richard Laird, and you're going to be hearing from Jeff Sachs, and you've had the previous session of individual chapters. So you'll know that the World Happiness Report every year is a mixture of analysis of the overall rankings and reasons for those rankings, with chapters that dig down deeper, making use of all the different ways in which well-being can be measured and understood. The focus for this year's report was on caring and sharing. We start out, we include as always what the overall ranking of countries is, and then we start digging into the caring and sharing supports for that well-being in our special analysis in chapter 2. This is a familiar figure you're seeing in front of you, but you probably can't see it. The individual countries, but you see we not only show the ranks of each country by the measure of the Cantrell ladder averaged over 3 years, but we also show where that rank range is if you look at the numbers at the left hand. So that's the range of ranks. Well, on the right you see with those vertical lines, that's the actual standard deviation of that country's rank. So there are not many countries that are in a group by themselves. And this year, for example, at the bottom, Afghanistan is in a group by itself. Indeed, it's a privilege. It's increasingly shared over the years. Alas, it's true that in Afghanistan for the last 3 years, the scores have set new records for the lowest scores ever seen in the international comparisons. That average of 1.3, indeed, it's even worse for women. The biggest gap between males and females around the world is in Afghanistan. And while in the world as a whole, it slightly favors females, in Afghanistan, they're very much disadvantaged. At the top, we've had Finland for several years now. The Nordic countries are all in the top 10, as they often are, not always, but often. That's given rise to some discussions about whether that, and I think you'll see this if you've seen reports from the Global Flourishing Study, that they suggest there that the high rankings of the Nordic countries are due to their higher levels of GDP per capita. The nature of, you'll see what I'm showing you, is that in fact what's special in the Nordic countries is not high levels of income, but high levels of a whole range of things. Indeed, we found over the years that you don't get to be in the top 10 unless you're pretty high on all the 6 measures that we use to partially explain what's going on in different countries. And as you probably know, that's GDP per capita. Do you have someone to count on in times of trouble? Life expectancy, healthy life expectancy, freedom to make key life decisions, generosity, and perceptions of corruption. in a group like ISQOLS, of course, you know that those 6 factors, although they tap into very different areas of life, in fact, they don't cover the whole range, and they cover it only in an approximate way. But that's the nature of the science we have, that you make the best use of the data you have at hand and keep searching for better. Now, here, given our focus on prosociality, we show the movements over time here by the world's regions in the 3 measures in the Gallup survey: helping of strangers, donations, volunteering, and then an overall measure, which is engagement in any of those 3. You see that the different parts of the world had rising and falling trends. They're rising most of the world, in general, from the beginning to the end, most generally in sub-Saharan Africa, and more universally in sub-Saharan Africa, to some extent MENA as well. Declining in North America and New Zealand slightly, but you notice the universal common feature is that during the COVID years, all of those measures shot up, and especially the helping of strangers. Indeed, in our previous few reports, that was part of our analysis, given we know how important the helping of others is to one's own happiness. It says on my timer that I've been going for 13 minutes. That can't be true. I guess it's because I opened it up. So someone else will have to tell me.
I'll keep time, John. Don't worry. You just keep going.
You betcha. Everybody's had an increase in the COVID years. There's been some reduction during the last couple of years. You'll see in particular the very most recent years. But in all regions of the world, helping of strangers remains above its pre-pandemic levels. And during our earlier reports, we were making great pains to show that this was one of the things that was going well, while lots of other things were going badly, because the overall life evaluation trend, in fact, did not change during COVID. Trends that were going on pre-COVID operated almost the same during COVID, which is quite astonishing in a way. And it shows quite a resilience that people, when we know how much face-to-face contact matters to people, and those were torn asunder in so many ways. We analyzed in the early years, and he said this was the case when social media became really social media, that they enabled people to think of new ways of reconnecting. And one of these, of course, was helping strangers, neighbors, and so neighborhood growth, neighborhood attachment grew dramatically during this period as people were not going to Machu Picchu, but they were out on the streets helping their neighbors. Now, the key thing I point out, and we point out in the report, that this growing benevolence. He said, what's going on? Why is benevolence so important to supporting well-being? We surveyed the literature heavily, and we said, well, it's not just any old benevolence. The benevolence that's most effective in raising well-being is that combines 3 things. Caring connections, so they have to be connections, they have to be ones that involve care, and that people doing the generous acts have to be doing so by choice, not by compulsion. And for sustained increase in well-being among givers, it's important that they understand and believe that there's a clear positive impact in what they're doing. Well, in this slide, 2.4, what we're showing here is the importance of benevolent acts. Now, this is based on 1 year of the Gallup World Poll data, where it was possible not only to measure the 3 usual benevolent acts, but to find out how people all over the world thought the likelihood of their wallet being returned. And consistently with this, and thank goodness this was done in the context of the Lloyd Register Foundation risk poll, there were comparably measured probabilities of very bad events happening. So on precisely the same scale, people were asked, how likely is harm from mental health in your future, short-term future? How likely is harm from violent crime? So there's a 5-point scale, and this is seen as very likely. The positive risk measure, and this was, I encouraged them very strongly to say risk is not all about things that can go badly. Like lotteries, other things can go well. And so what is the likelihood that your wallet would be returned if found by anybody? And then we take those measures, all of them, and add them to our overall modeling of well-being measured by the Cantrell ladder. And we say, what does it matter? Well, we've put 2 of the conventional things in here, that which being unemployed is 0.5 point on the 10-point scale. Doubling of income in this 1-year modeling is, this is all in individual level data, up 0.1 point. Harm from mental health, minus 0.25 point, violent crime, 0.16, and wallet return, benevolent acts. So any of the benevolent acts, that first line we looked at above, raises your well-being by almost 0.5 point. So it's more than unemployment, more from either of those others. And seeing others' benevolence, there are 2 issues here. Your own benevolent acts, which is the one that's measured regularly in the Gallup World Poll, and then expected wallet returns. In other words, your own wallet return being seen as likely is massively more important than these negative things. So not only is benevolence important, it's actually more important than a lot of the negative things that analysts all over the world spend much more time considering the measurement of and the selection of policies to improve. Now, an extra twist that we discovered earlier and now we re-emphasized this year is the measurement of inequality has too often been measured in terms of income inequality, while in fact, the inequality that really matters, if something more than income matters for life, then clearly something beyond income inequality must matter as well when you're thinking about distribution. So we measure the distributions of well-being and ask what's happened to them. And here we find a mixed picture. If we separate the well-being inequality as to that within countries, and that this is the inequality of subjective well-being. Thank goodness with an 11-point scale, we can actually get distribution statistics that can measure inequality. And so the inequality within countries, the top line, has been rising significantly over this period, while between countries it's been roughly constant. And so the international share of inequality has thus been declining during that period. So rising inequality within countries is a big deal, just as it has been for income inequality. But the other sources beyond income have also grown in inequality in many countries. So what about benevolence, and what does it do for inequality? So to analyze that, then we ran our individual data model and said, let's look about the consequences of bad things for people who think. This is now done within the context of the European Social Survey, because they have 2 nice measures of the expected benevolence of other people. One is, do you think that others are fair? And another question says, do you think other people are helpful? People who think that respondents are fair and helpful, and that's a pretty good measure of the benevolence of society you think you live in. Then we interact that binary split with indicators of bad things. So you see unemployment hurts less if you're in a caring society. Being separated, divorced, or widowed hurts much less if you're in a caring society. Bad health is much more easily accommodated. Very important, though it still is. And this is low health on a 5-point scale. So this is the worst of health conditions compared to all the rest. To be a member of a discriminated group, this is how you describe yourself as a member of a discriminated group. It's only about a quarter as costly to your well-being if, in fact, you live in and the most striking differences. If you think you're unsafe after dark in the streets, if you think other people are fair and helpful, even if you think the streets are generally unsafe, it doesn't affect your life satisfaction, and that's because you think the environment in which you're living is not one that's going to be damaged. Now, from that same general modeling, we were looking at interaction effects. Here we're saying, let's ask ourselves how important being fair and helpful is generally. See, was looking at being fair and helpful was much more important for people who are in high-risk situations than everybody else. And this is what it is for the whole population. These are the main effects. So you can see believing in the benevolence of others, i.e. thinking that most people are fair and helpful, is much more important than the other conventional measures of positive social capital that we traditionally measure, and indeed, which are very important. Look at those vertical lines showing all of these are very big effects. But thinking other people are fair and helpful is the best. Okay, so now we're getting to a state where you say, all right, if it's so important to think other people are fair and helpful, how important is that in I'm going to go to this split first, and I'm going to go back. I'm not sure I had the right order. How important is actual benevolence compared to what you expect? Because remember, when I was going through the modeling, it was the case that it was how you saw the state around you that was being measured and was very important. But then the question is, what is the real state of affairs? Clearly, to think just to say I'm going to think people are good when they aren't is risking danger. So it's important to ask whether people generally are too pessimistic or not about the environment around them. So we now had through some experiments that were done in 50 countries, dropping of wallets. There are many other experiments as well, as I'll show you in another slide. But the point of this slide is to show you that on average, the expected return of lost wallet, if found by a stranger, because that's what was being essentially asked in the experiment, is half as high as the actual rate of return of wallets. And that turns out to be true in any range of evidence, and I can show you that in this context. This is true both within country experiments. The one we've talked about in papers over many years is some wallet dropping in the Toronto Star. We'd already had from the Canadian General Social Survey these wallets included since the beginning of the century in occasional surveys. And so we knew exactly what people thought about wallet return in Toronto, and the Toronto Star dropped wallets in Toronto, and the expected return was 38%. I'm sorry, that's the Lloyd Register one. The actual expected return from the General Social Survey was less than that. It was a quarter found by a stranger. But here we're using for the expected what we got from these answers to the wallet question in that current round of the Gallup World Poll. So it was many times higher using the General Social Survey data. These Lloyd's Register Foundation data, of course, for the nation as a whole, are not for that particular set of people. Then Rober's analysis in the US, he, without knowing of this other research, dropped wallets in cities all over the United States and a couple in Canada. And then we were able to match those with the expected return of wallets. And he found, with interesting sub-experiments, that this return of wallets was equally great in rich neighborhoods and poor neighborhoods, equally great as between genders. And so it's a general phenomenon that people are much more generous than you think they are, which of course implies that the negativity bias, which has been so much a central feature of psychology, is in fact still dominant. And in a very costly way, obviously, because people who are brought into the realm of truth enough to realize that people are much kinder than they thought they were are going to act much differently towards other people and are much more likely to meet the person in the street they don't know and consider them a friend they haven't met rather than a stranger to be avoided. These issues have clear relevance for what's going on in the world as we speak, but I think I will turn it over to you now to get a more general discussion, as I'd love to answer questions both about how good these measures are of the quality of society and what else might be going on. Thank you very much.
Thank you, John. So we can take questions from the room. You just speak into the microphone as normal, and John will be able to hear you. Do we have any questions? Yes, there.
Thank you. Thank you, John. It's a great report. It's my favorite of the World Happiness Reports in many years. I think it's a very important topic. But given that the topic was caring, I was surprised that you didn't look at carers or caregivers, so people who look after family members, often at a full-time basis. People who, their family members might be sick or disabled. And we know that they can be up to 10% of a population and that they have low well-being. So was there a reason why you didn't look at that population in particular?
Well, we have in other work looked at, but we can't get those people in the data we use, so that the big scale data we're looking at are population representative samples. So we can't then find who are the people who are giving care. There are many people who've studied this, and as you might guess, it's like the rest. This kind of excessive concentration on the bad things have stopped people looking at the good things. So the emphasis is on caregiving, has been caregiver burnout, a whole range of situations, and rightly focusing on places where there are problems, but that doesn't capture the balance of where caregiving gives pleasure rather than pain. And of course, you have to improve it to make sure the balance of pleasure is much more. Let me give you a specific example of some research that was, because there is quite a lot of research of specific forms of caregiving. For example, peer-to-peer support of cancer survivors has been an important thing. And originally, most of the studies were, and they found that the people receiving this peer support from previous cancer sufferers was important to how they dealt with their future lives and accommodated to the situation they found themselves in. But only later did somebody say, let's go and look at the well-being of the caregivers themselves. They are now being forced to maybe relive those awful experiences they've been through, and they'll be feeling much worse about things, or at least not better. But they found that systematically, the people providing this peer-to-peer support had increases in well-being relative to controls or previous, before and after, bigger than the benefits for those receiving that care. And that's a routine result across this field. So without wanting to cast, it's very important to look at problems where they exist and to deal with them. But to think of caregiving itself as a place that's mired in unhappiness does not reflect life when it's properly looked at. Of course, that's the essence that brought positive psychology into existence in the first place, and that psychology was concerned with finding problems, indeed the treatment of physical health the same way, and then trying to solve them. The problem, of course, with that is if you have a problem-centered view, you adopt the wrong ways of dealing with them. And the same is true for caregiver burnout and other things. And I can get on to some of the other issues about how parallel issues have been dealt with and studied and with respect to caregiving and elder care facilities and so on. But the important point is that, in fact, a caregiving situation and receiving situation relative to distancing raises the average, and indeed for the givers as much as the receivers. Too long an answer, but I hope I brought in the kind of information that we do have, even if we don't have that kind of thing at the global level.
Thank you, John. I think we have time for one more question. The lady there.
Thanks for the very interesting presentation and snapshot of the report. I wanted to ask you, have you reflected and do you plan to engage with the causes for caring and sharing, general caring and sharing, and the aftermaths of it, what it means? I'll expand a little bit on that. So in terms of the causes, it might be quite sensitive to economic incentives, because from Weber and from disenchantment of societies and so on, we would expect that, and from Robert Putnam as well, we would expect that when people have less economic incentive to care and share, when they get richer, they would care and share less, right? Until something bad hits. And I think this relates to your findings that during COVID, people kept caring and sharing. Normally, you'd expect it even to increase, but in this particular shock, it was at least keeping equal, because being in contact with others was the main problem in the disease itself. So this is the first, so the endogeneity of caring and sharing, and in how it emerges. And what is even more worrying is what it means, because people may feel good, and that's a valid and important thing. But essentially, caring and sharing attitudes mean social capital. So having social capital is a good thing for those who participate in the group. But this coincides, as we know very well, with the rising nationalism and polarization. And we know from previous research that actually the Nazi Party managed to succeed in the places in Germany where there was some pocket of social capital that they could exploit. So the aftermaths may be good and may be bad. And I think there were even such papers circulating here that one thing is to have life satisfaction, but the aftermaths may be good and may be bad. So what are your reflections on these two things, the endogeneity of caring and sharing and the aftermaths of having the caring and sharing? Do they always lead to a good thing, and how we know what they lead to? Can it be predicted somehow from the cause for why they emerge, the caring and sharing? You see what I mean?
I mentioned briefly at the start of the presentation some of the things that explain the heterogeneity of the results of the caring and sharing, and the 3 C's that Sara Konrath emphasized for us was the based on caring connections involving choice on the part of the people doing it and having a clear positive impact. And so those things are all differing in different environments and so on. And part of that is the people were emphasizing that you didn't get the same gain if you had an economic incentive to do so. If people were paid to do something good, they were much more likely to get benefits from it than if they didn't. Now on the other issue, which has been raised as is called in the early days of social capital research, called the dark side of social capital, that indeed the power of people sharing a common social identity and caring about each other, so in other words, a positive shared social identity, can be exploited for good uses as well as bad. And of course, nationalism is one of those. Nationalism is really a form of creating a sense of common purpose, and you can see that groups under external threat, indeed, some of the deeper analysis of the reasons why the Finnish sense of caring and sharing for each other is so high is that indeed it was formed under the threat in part of the Winter War almost 100 years ago. And we've seen that with respect to natural disasters, and it's true of external political threats as well, that it allows people to see each other cooperating in a common cause. For the world as a whole and for well-being in the world as a whole, it's critical to avoid situations where internal sense of caring and sharing is built at the expense of the design or construction or recognition or exploitation of another. So you have to, in fact, for solving both environmental issues that you were talking about in the previous session and all other problems, the social identities in question, positive social identities that exploit and build and encourage caring and sharing, have to be broader rather than narrower. And it's quite explicit in the divisiveness that's appearing in much political discourse in the last decade, has in fact been people attempting to exploit this caring and sharing by creating another, which is then defining the us in the context of a negative other. Well, quite clearly for the common cause, for the world as a whole, that's a bad thing. So let's get back to the policy implications of how you deal with methods of constructing and encouraging a sense of common cause. You simply do not want people to say us first, other people second. That's not the way to build well-being, either for the smaller groups over the long term, but especially for those who are treated as others and negatively in the meantime. Too long an answer again, I'm sorry.
No, that's okay. Thank you very much, John. We'll need to move to the next presentation now, but we'll just one final round of applause for John Helliwell.
Okay. Yeah, Hi, everyone. It's my pleasure today to present this study, which is joint work with Jan de Neve at Oxford, Andrew Duggan at Gallup, Mika Katz at Harvard, and myself, I'm Alberto Prati, GCL. And most of 90% of what I'm presenting came out as chapter 3 of the World Happiness Report, but there is a little bit of new stuff, which is part of the work in progress, the research agenda on well-being, sharing meals, and social connections that we are continuing to work on. So first thing first, why sharing meals? We know that social connections are extremely important for well-being, but we also know that social connections are deeply related to sharing meals. So the connection goes very back in time. Actually, in the words that we use, think of the word companionship that comes from Latin, cum panis, with bread. So with reference to the fact of breaking bread together. This is also true in French, in Spanish, in Italian. We found out even in Chinese. So in Chinese, the word for partner apparently means fire mate, literally. So with reference to the fact of sharing a meal around a campfire. So we have this relationship between sharing meals and social connections that goes very back in time, but more from a social science perspective, the reason we were interested in sharing meals is that it can tell us something about social connections in a comparable way. This is very important when we are working on a global perspective, and sharing meals is a social ritual which arguably is virtually universal, is very common across cultures, so not only over time. And on top of that, the fact of sharing a meal is a tangible, concrete behavior. Now, the reason this is important is that when we are studying the relationship between subjective well-being and another variable, it's important that this other variable is not subjective. I mean, it's important. Don't get me wrong, subjective variables are incredibly important, but the study of the relationship between subjective variables is subject to some statistical problems. The correlation tend to be inflated. So what we would like is an observable measure. Typically, measure of social connections are questions such as how many friends do you have, or do you feel that you have social support? And these questions tend to be more subjective. So here we use an observable behavior. We don't actually observe it. It's self-reported, of course, but we use this concrete behavior as an indication to tell us something about the social connections. The data we use are from the Gallup World Poll, most of them collected in 2022, a few in 2023. And the question that was asked in these 142 countries was, think about the last 7 days. On how many days did you eat lunch with someone you know, or dinner with someone you know? It can be friends, colleagues, or family. And answers could go from 0 to 7. We poll the answers together. So the results I'm going to show you, the variable sharing meals goes from 0, no meals shared, to 14, all meals shared. And I will refer to the 0 as dining alone, the fact of not sharing any meal during the previous week. And this is, a wink to Robert Putnam's Dining Alone book, Putnam, who was just mentioned. Going to give you takeaway results, and then I'm going to explain you over the talk how we found them. So the number of shared meals turned out to be a very good predictor of life evaluation and affect. And when we look at geographical variations, North America and actually Australia and New Zealand as well stands out as outliers, as places where it's particularly important. This relationship is particularly strong. When we look at the evolution over time, in the US, over the last 20 years, the proportion of people dining alone, not sharing meals, has increased dramatically, and this is driven by the youngsters. Not surprisingly, those who dine alone feel sadder, more stressed, more lonely, and more isolated. So here there is kind of an alarm about this. The positive side is that sharing extra meal can reduce well-being gaps within the population. That is part of the new research agenda. And just to be clear from the beginning, everything that I'm showing you is correlational. We don't have the possibility of make causal inference. I will watch my vocabulary, but if I talk about effects, there will always be the risk of some reverse causality. First thing first, so for the first time, we have a global data set about the frequency of meals shared. How does it look? Do people have the same habits around the world? And the answer is clearly no. There is a lot of variation. So it goes from about 1/3 of meals shared in South Asia, Japan, and the Philippines, up to about 2/3 of meals shared on average in countries such as Colombia and Ecuador. A lot of geographical variation, but how does it relate to well-being? Well, if you look across countries where people tend to share more meals are also countries where life evaluation tend to be higher, also controlling for other variables. But more importantly, within a country, people who share more meals tend to report higher levels of life evaluation and positive affect. And the relationship holds strong when you control for other channels, such as difference in age, income, living alone, or people's ability to afford food. Now, we were expecting some relationship, or at least hoping to find some relationship, but what was surprising to us was how strong this relationship is. And let me show you two figures to give you a sense of the strength of this relationship. So the first one tries to answer the following question. If I ask someone, how many lunches and dinners have you shared during the last week? How much am I learning about their well-being? And to answer this question, we regress life evaluation, positive affect, and negative affect measures. I'm not going to show you negative affect on the number of shared meals or on the key socioeconomic determinants that we use often as a benchmark, which is the income quintile. So either shared meals in 5 categories or the income quintiles. And it turns out that we learn as much from these questions about shared meals than from the question about the income groups when we are looking at life evaluation, and even more if we're looking at positive affect. So the bars are the R squared of the relationship that I just described. So the amount of information that we're capturing with this very simple question, the amount of variance in well-being that we managed to explain, is actually considerable. What about the magnitude of the relationship? Let me start by inviting you to focus on the circled part, so on the world average. So when we regress life evaluation on the number of shared meals, every time controlling for a bunch of other social demographics, the estimated coefficient is 0.03 on average. What does it mean? It means that everything else equal, if you compare someone who dined alone, who didn't share any meal last week, with someone who shared all their meals, the average difference is going to be 0.4 points in their life evaluation. This is a very big difference in terms of life evaluation points. It's what is typically estimated to be equivalent to the effect of doubling someone's income. Of course, this is a pretty extreme differences from sharing 0 meals to all the meals. But what you can also see from this graph is that there is a lot of variation across geographical areas. And in particular, the first, this is sorted in terms of the magnitude of coefficients. And in North America, Australia, New Zealand, this relationship appears to be particularly strong. They're essentially outliers. So areas where the importance of sharing meals seems to be particularly high. Now, why this place? Why North America, Australia, and New Zealand? We don't know. So this is part of the work in progress, and I'm showing you this slide more to have your thoughts rather than for me to give you an answer. What we thought about is, well, it could be that, dining alone in a place, in a country where the people who are sharing their meals tend to share more meals might be particularly detrimental. But this is not really what we observe. If we look at the relationship between the estimated coefficients for dining alone and the average amount of meals which are shared by the rest of the population, it's more of a U-curve. So it's mostly, the effects tend to be smaller in places where people don't share many meals or they share a lot of meals, while somewhat in the average, Europe, North America, and other regions is where we see a bigger gap. Oh, wow. Okay. So what we wanted to know is, what we wanted to know is, how has it changed over time? We would have loved to give an answer how this habit of sharing meals has changed over time, but we don't have the data at the global level. However, in some countries, this data has been collected for a long time. So we try to dig deeper into North America, and in particular the US. And for this, we use the American Time Use Survey, where a representative sample of the population for over 20 years has reported their habits during the day, including with whom they were having their meals, and in some years, also information about their well-being. And for this analysis, we focus on dining alone, so reporting to eat all meals the previous day, in this case, reporting to eat alone all the meals. What do we find? I think the figure essentially speaks for itself. That is to say, we have this increasing trend over time from 2003 over 2023, moving from a little bit less than 20% of the population dining alone the day before up to 27%. And of course, during this period, there has been a lot of other changes in the US. Probably the most important for this variable, the increase in single household sizes, but this doesn't explain much, actually. It explains up to 20% of the trend that we observe. So people are dining alone more and more in the US. With every passing year, who's driving this trend? And we looked at different explanations, and what comes out very clearly is that the younger generation is the one that is driving this trend. So this graph shows you the variation from 2003 to 2023 by age category. So the way you understand the graph is if you focus on the black line, you see that at the end of the series, it is at 1.9. What does this mean? It means that today, the 18 to 25-year-old are 90% more likely to share no meals on a single day than those of the same group, of the same age group, 20 years ago. So there is a general increase, but this increase is really driven by the 18 to 24-year-old and 25 to 34-year-old. The American Time Use Survey asked in 4 waves during these 20 years, also information about well-being. This is partly due to the day reconstruction method that was inserted in these waves so that we know how people felt during those days. They're asked how happy, tired, stressed, etc. they felt. And we can therefore compare those who didn't share any meal with those who had meals with someone else. And what you can see in the bar chart is the blue bars are higher for happiness and lower for stress, pain, and sadness, meaning that those who didn't share any meal on that particular day tended to experience more negative affect and less positive affect. If we move back to a global perspective and look at the relationship with more standard measures of social connections, so the feeling of loneliness or the feeling of having someone you can count on, we found what we sadly probably would have expected to find. That is to say that the less people are sharing meals, the more likely they are to feel lonely or to have no one that they can count on. But on a maybe more positive note, and this is again part of the work in progress, we also wanted to look at who does benefit the most or the least from sharing meals, because there are important differences here in the opportunity of social connection. Think of someone who always have dinner with someone else. Either you're living in a family or you're living alone. These are 2 very different experiences. They're 2 very different cases. So we try to focus on groups for which we expected them to have less opportunities of interaction. So people living alone, people being single or not in a partnership, people being unemployed. And except for the urban large city divide, where we don't really observe much difference, what we observe is the following. We know that people who have less opportunity for social connections tend to report lower life evaluations. We already knew this. This is given by the difference between the blue and the red line. But what is new is this increasing trend related to the number of sharing meals. So the more shared meals, the higher the life evaluation. There is a converging trend. That is to say, this gap is reducing for people who tend to share more meals. So there is, let's say, some hope maybe to diminish well-being gaps. Let me be very clear. This is about the world, so it's masking a huge heterogeneity. And an example of this is if you look at Western Europe versus Latin America, living alone in Latin America has a very strong convergence. The fact of sharing extra meals in Latin America brings to a very large convergence, but not really in Western Europe, vice versa for being partnered or not. So among those who are single, sharing extra meals brings to a much steeper increase in well-being, but not really in Latin America. This is a global data set. It's very hard to, explain all these differences, but we are looking into it. But I think it's time to wrap up. So what did we learn? We learned that rethinking about this social ritual, the fact of sharing meals, how we gather around to break bread together, can help, have some practical solutions to reduce loneliness, social isolation, and increasing well-being. What could be a practical solution? Let me give you an example. Think of Harry Potter. He never has lunches and dinners alone, but even without magic, more concretely, think of the colleges in Oxford and Cambridge, which I think are a great example of how an institution can help people sharing their meals in those colleges, in those universities. At lunchtime, students and faculties go to a big dining hall, and the social norm is to sit close to each other. It's very rude to go to the lunch and then dine alone. And this is, it's just a matter of social norms, but it arguably helps creating tighter social knots within the university. And this is definitely not the case in universities. Let me conclude with a caveat. As I said at the beginning, everything I showed you is correlational. We are unable to tell what the causal effect of sharing an extra meal is. We have a typical chicken-egg problem. People who report higher levels of well-being are more likely to be extrovert, to reach out to people more. And this is the next step of our research agenda, is to give a clear and precise estimate of what the effect of an intervention to increase sharing meals is. And room for debate. Please.
So thank you very much for your presentation. I love the topic and also the way you presented it. Every time I got a question in my mind, you responded to it afterwards. The only negative thing is that I think a lot of people got very hungry after your presentation, after talking about food and food. But one question I have, very basic, and it's relating to something I learned yesterday. There were some researchers that showed that job satisfaction is much more important for men than family satisfaction. So do you think you can see a similar effect on having lunch together for men or for women, if you can see the gender difference as well? Or?
Yes, the answer is no. There is no specific trend in the strength of the effect. There is also no important difference in the likelihood of sharing meals. So we do not see any specific gender effect on this. As for the family versus job, is probably for the next presenter.
Great, thank you.
Hi, thanks a lot. I had a thought on this paradox that you found, that the effect of dining alone is less bad in countries where many meals are shared, right? My thought was that maybe it could be interesting to look at who is actually dining alone in countries in which many meals are shared, because if this is a very small fraction of the population, it might boil down to people who actually don't take so much out of social interaction, and maybe then for them it's not such a bad thing to dine alone, while in countries where people like have a medium share of shared meals, then maybe there you really have like the whole range of people, including those who would actually really prefer dining with others.
Great point. Yeah, I agree. I do. Yeah, it's a very good idea. Jessica.
Thanks so much. It's a really interesting topic, and it's something that we're starting to do some work on. So I love the chapter when I read it. And we're thinking, too, about the policy kind of implications of it. I have questions that are beyond the work that you've done, but I'm curious if it's something that either is something you're interested for future research or that you came across kind of in the literature. So first question is thinking about, does the format of dining alone matter? Because there's a really big difference between going out to a restaurant to eat by yourself versus cooking for one versus ordering in like takeout meals. And I'm thinking that probably does really matter, especially if you're looking in the US data that it's being driven by young people. So just curious about that side of it. And then I did have another question, but I'm forgetting what it is now. So if I remember it, I'll come find you after.
Yeah, on the top of my mind, I can't really answer your question about the restaurant versus eating at home. What I can tell you is there are some studies in psychology about the way of eating, and eating with a phone tend to be associated with higher stress and lower mental health. But definitely there is, what you're hinging on the type of eating alone and the type of eating with someone else. Yeah, that's super important, and there are a lot of questions there.
I did remember the second, if I could be really quick. The second is, did you find in any of your work a link between nutritional outcomes and eating with others? Because I have seen a lot of work on this for younger children, especially like family meals. It leads to better nutritional outcomes, but I just wonder if there's research that's doing that link across the life course.
There are definitely studies showing that the quality of nutrition is related to well-being, including subjective well-being variables. In our data set, we just don't have any information about what people are eating. So yeah, we can't say much about it.
I think we'll have to move to the final presentation now, but I think Alberto will be around for any other questions.
I'm really sorry to be standing between you and dinner. Thank you very much for staying. Especially, I'm starting to lose my voice a little as I'm running around trying to keep the technology working. I wish I were a comedian on your behalf, especially not to be talking about deaths of despair, something that comes across much more negative. I'll tell you though, deaths of despair aren't my intrinsic interest. This came really out of fighting skeptical economists, among others. You go to the restaurant, the pub, the coffee break, and you tell people you study happiness, and then you tell them you're an economist, and they take issue with this. And part of that was because of this early finding that you have really high happiness. It's the highest ranked country these days, Finland, but you also had a really high suicide rate. So it seemed to be that these are at odds, and of course people trusted the objective information, not necessarily understanding the causes behind suicide. They're, as Helliwell will tell you, they're two very different things. And that's part of what comes up in this chapter. But I'm not going to talk about it more today. I'm going to dig right in, and we'll try to look at deaths of despair as kind of a form of ill-being, and look at prosocial behavior as a explanation. So we start off with the American case, just to help give you some understanding of the background in case you're unfamiliar. So first off, deaths of despair is comprised generally of three categories of underlying alternative mortality causes. So suicide, alcohol-related deaths, and drug-related deaths. And you can see in the US context, right around 1970, the numbers are flattening after a large growth period, and then they really spike again in the year 2000. And this is an absolutely incredible number. The figure doesn't really do it justice. So to give you some perspective, right, so this is 45 people, but per 100,000, and so the per 100,000 is so we can compare different countries. And in the US context, there's a lot of people there. This equates to about 150,000 people per year. This is nearly a quarter of the population of Luxembourg. So in 4 years, Luxembourg would be no longer here if they had the same sort of statistics. So this is a huge number, major cause for concern. So what can we do, if anything, about it? So the global trends also, because very little was known outside the US. So much of this research was done on the US in the past. And part of that was because perhaps most of you are familiar with the opioid crisis, which may or may not have been just a US phenomena. So here we have some global trends from a friend who's here, a colleague who's here at the conference, Lucia Macchia, and there they point to a rising level of distress, emotional distress around the world. So this is suggestive that emotional distress is probably a leading cause of depression and maybe suicide. So this is what we have. So the next step was to try to look at deaths of despair, see what the trends look like, and then again see what we can do, if anything. So the research question, as I mentioned, is we actually start one step back still. What are the characteristics of death of despair, and how do they compare across groups and within countries? How have they changed over time? That gets back to this question of what happened in the US and the global trends. And naturally, then, if we find out how they're changing over time, what are the explanations? And prosocial behavior is a subject of interest in my research department. So I didn't mention at the beginning, I'm part of StatTech research. This is joint work with multiple colleagues, Francesco Saracino, Chiara Peroni, Fengyu Wu, and Julia Slater. My name is Kelsey O'Connor. So prosocial behavior is a subject of interest of ours, and also it follows very well with the theme of the World Happiness Report and an interest of John Helliwell at this time. So what do the data look like? First off, a definition. There are different definitions used in the literature. And part of that is based on the country context and the statistical system. But they're commonly understood to be deaths due to drug, alcohol, and suicide. Our precise definition comes from the World Health Organization and is comprised, again, of alcohol use disorder, drug use disorder, self-inflicted injuries, which is representing suicide, and ill-defined injuries and or accidents. And part of this idea behind the ill-defined is that in some cases you don't know what the intention was of the individual who passed. And in some countries, those people who may have understood to have committed suicide, but they weren't labeled that way for cultural reasons. So we include them based on best practice. The data come from the World Health Organization, as I mentioned, and so it's this WHO mortality database, and it's really helpful. They make the data comparable over time, and this was instrumental because you have the causes of death changing. And you can imagine that we're not just getting alcohol use disorder or drug use disorder. There are, I think it's like approximately 180 different causes of death, and it's all in here. And so if you're curious, it's a good source to check out. One of the limitations, though, because of so many causes of death, not many countries prepare this information up to standard. And we just lost the slides. Sometimes it's finicky. A couple of hidden technical problems throughout the day might as well come up again. Thank you again. So many of the countries are missing. That includes China, that includes India. Most of the low-income countries and some of the middle-income countries are missing. So we work with a sample of, is it loading? So we had the longest and broadest sample that we could construct in order to try to give you a sense of the global trends. So it's from 2000 to 2019. Even though this was conducted in 2014, a lot of the countries just didn't have data moving into the COVID period, which would have been really interesting. And prior to 2000, there's little data available. So what do they look like? So first off, here's the ranking. You can see that there's a fair amount of variability. and that we have fairly high numbers also in the United States, as expected, right there towards the middle. And then Guyana, a country I wouldn't have known to look to. Slovenia actually has the highest level of deaths of despair. And you can see the colors, if they're distinguished properly. Alcohol is a very, very large component for them. So alcohol use disorder is killing more people in Slovenia than in many of these other countries, all of the deaths of despair combined. You can see kind of generally across. So this is not a phenomenon that is confined to just North America or any one particular region. It's happening everywhere. And the number is approximately 23 on average across all of these countries. And you get a sense of how many people that actually reflects. So in a country like the UK, you multiply it out by the population, this equates to about 12,500 people per year. Is that a large number? Is it a small number? They're preventable deaths. It's premature mortality. These are things that, deaths that we should be able to prevent. So I think any number is large, but this gives you a sense. Here's what it looks like. So I'm sorry, I get a lot of tables because for me, that's just a little easier to see. And so I gave you the number there, 23 across all countries. And then if you compare men and women, you can see that it's approximately 4 times as large among men, or 1/4 among women. So men are dying at a much higher rate. And then if you go down also, you see that it by age, it's primarily among the eldest group. In particular, the men of 60 plus, they have deaths at 50 or more per 100,000. And you compare that with the smallest group of women, 15 to 29, where it's fewer than 10. So you have deaths of despair much greater among men, and then the 60 plus more than double the younger group. And a lot of that is due to alcohol use disorder. Here, however, is some very good news. So these are the changes over time. And you see just most of the blue bars are below 0. So 75% of the countries are having fewer deaths of despair year on year. It's declining over time. And then notice that there are just a few that where it's positive, and that includes the United States and Canada. So the story about deaths of despair frequently is based in these kind of Anglo-Saxon countries like the UK and offshoots. So there, it's really increasing. However, you also notice South Korea. I mean, for South Korea, it's a different phenomenon that's causing the change, but there is a worrying rise there as well. But in general, I take this as good news with the exception of a couple of countries. Here's what the changes look like. You can see, so on average, this is per year, we have about a decline of 0.24 per year per 100,000. And if you want to compare then across the different countries by income groups, you see that the number is a little bit smaller in the highest income group, so it's 0.09. And then in the upper mid and lower mid, it's a little bit different. And then to focus in on the causes, you see that it's mostly a decline in the number of suicides. And then the drug use is a positive number, especially in the high income countries. So the high income countries have the smallest decline, and part of that is because they have a rise in deaths due to drug uses. And the decline is in suicide is driving everything on average. Okay, so explaining deaths of despair over time, we have the case of prosocial behavior. So John and the folks behind chapter 2 provide a really nice background, but let's talk about it a little bit in more specificity. So prosocial behaviors are behaviors that are done for the benefits of others. This is perhaps obvious, and we're going to measure it using the Gallup World Poll data. So it gives us the broadest country sample, and it's based on the 3 acts: donations, volunteering time, and helping strangers. And what we do is we just look at the answers to these questions and average across them. And we can think of this, or why might prosocial behavior influence deaths of despair? And it's through both individual as well as societal mechanisms, both direct and indirect. Part of what John talked about before was just believing that somebody else would return your wallet, right? This is a kind of societal fabric mechanism. So prosocial behavior contributes to what you might say is the societal fabric. Give you some examples here. So individuals, based on the literature, who engage in prosocial behavior are both healthier and happier. Prosocial behavior buffers individuals against the harmful effects of life challenges and reduces the likelihood of resorting to maladaptive coping mechanisms such as substance abuse. So you go for your volunteering session, and then afterwards you're more likely to go out and have dinner with the other volunteers and not eat alone. It also provides support for others and fosters positive societal characteristics, both within civic networks and across diverse groups. So there's this individual set of mechanisms as well as societal. So the regressions, so this is for our skeptical economists. I provide a little bit of detail here, but it'll go quick. So we have basically, we're trying to explain deaths of despair as a function of prosocial behavior, that's this PSB here, a set of controls, mu and lambda, and these are country and time fixed effects. For those who are not familiar with this, what this means is by including this, we're going to look at the change of prosocial behavior and the change of deaths of despair within country. So we're not comparing countries at a point in time. We are not comparing countries that have different cultures, which is really important in the death of despair literature, because they have different reporting, for example. So we're going to look at, does an increase in prosocial behavior within a country correlate with a decrease in death of despair? Now, actually, I had a long discussion with Samuel about our set of controls, and even more long discussions with my colleagues, because what affects deaths of despair? What affects prosocial behavior? These are societal level characteristics, and you can think of quite a few factors. And to note, we have, in this case, 50 countries based on the availability of data. The Gallup World Poll starts in 2005, as many of you are familiar. And we had to bring the two data sets together. So the control variables, we identified 25 that would plausibly explain both prosocial behavior and deaths of despair, 5 of which we had additional data wasn't available, so we treated them for robustness. So economic variables, we have GDP growth, we have the inflation rate, we have the unemployment rate, and the labor force participation rate. We have the population age structure, we have the female population share, the divorce rate, and urbanization rate. And part of this was based on conversations with the other members of the World Happiness Report, and we added as much as we could factors that, so the divorce rate was coming out of work done by Lina Martinez and Mariano Rojas, who presented in the earlier session. I wanted the dining alone question, but didn't have it accessible for this period of time. And religious importance. I think most of you would have raised your hand and yelled at me if I didn't include that. Quality of governance, health expenditures. The World Happiness Report variables that are used to explain the Cantrell ladder, the life status, basically the life evaluation around the world. And for robustness, I looked at the poverty rate, the income inequality, so this is measured with the Gini, public social expenditures, etc. So we considered basically the kitchen sink for what we had available. And this is what it looks like. And so I'm not going to take you through the whole set of regressions. You can see that there's too much there for one slide. And as you can kind of imagine, many of these controls have overlapping concepts, the quality of governance and social expenditures. So which variable is better? So Julia and I argued about this countless times. And so what we did is we did a series of regressions in which we eliminated the redundant controls, and we maintained ultimately just prosocial behavior in 5 controls. So prosocial behavior, you should note, is significant throughout all of these regressions. And in the initial period, you'll remember I included GDP and GDP growth. Prosocial behavior is more significant. It has higher explanatory power for death and despair than the level of development of a country. And we explain approximately 30% of the variation just with these 5 variables or the full set. So to show you the regression table, it's fairly brief. This is prosocial behavior is negatively correlated, and remember that this is a change within a country. So an increase in prosocial behavior is negatively related to deaths or despair. More prosocial behavior, fewer deaths. And those are the other controls. To give you an idea of how large this is, so we save approximately 260 people in a country like the UK, or I think, sorry, I did the US in this case. So in the US example, we save approximately 260 people for every additional percentage point of people engaging in prosocial behavior. And we break it down into the subcategories, so donations, volunteering, help the stranger. And you can see that actually it seems like the relationship is coming from donations. This is donating to charities. So Michael Plant will be quite happy for this. And volunteering and helping a stranger, they're consistent, they're related in the same way, but no longer statistically significant. So coming to our conclusions. So deaths to despair have declined. I showed you for 75% of the countries. Now, if you take the average across all countries, it looks like this. So it's actually the opposite of the figure I showed you before with the rise in emotional distress. So it is a different sample of countries. We have a smaller number. But for those of you out there who are really pessimistic, think the world is falling apart, well, at least people are committing suicide at lower rates. On average, they've declined. And if you look at the number here, it's about 5 deaths over this whole period. And in a country like the UK, this is let's say rounding up, it's almost 3,000 deaths per year. So this is good news. And the largest declines, I didn't have time to go into too much detail, are in the northeastern European countries such as Latvia and Lithuania. Baltics. So prosocial behavior, it is reliably connected. So increasing it within a country is reliably connected to declining deaths of despair within countries. So we have the same caveat that Alberto offered before. This is not causal, but at the same time, we are abstracting from things like culture or religious importance or economic factors. So those are not explaining the relationship. This is independent. And a 10 percentage point increase in the share of people engaging in prosocial behavior, this is another way to understand the result, is associated with approximately 1 fewer death per year per 100,000. And for large countries, that's a big number. For a country like the UK, that's about 550 preventable deaths per year. This is remarkable, I think, for both scientific and policy regions, and that's why we wrote the paper in the first place, is for both the scientific and the policy. It's part of a broader agenda, and I'll get to in a sec. So aggregated self-reports have meaningful information. So we have a lot of skeptics, not in this audience, thankfully, about the meaningfulness of self-reported information. And here it is predicting an objective outcome in a manner that's consistent with theory, saying that what people say matters. And it was more predictive of death or despair than GDP per capita was. So this is great for people like John Helliwell, who are very social capitally oriented. We should be focusing on things other than income growth to live better worlds. And that's part of what the policy conclusion is. So investing in something positive. So instead of taking a negative narrative about how we change the world to live in a better place, we can focus on something positive like prosocial behavior and get a win-win. So this is a good per se outcome, and it is likely that it contributes to fewer deaths of despair. I mean, that's what the analysis shows. We just can't say it's causal. And as I mentioned, it's part of a broader research agenda. So the idea here is to go from a vicious to a virtuous cycle. The vicious cycle is something that we observe more in a growth at all costs mindset, or growth for growth's sake. So we talk about this in what Francesco has called neo-humanism. We've worked on together, and a EU Horizon grant project. And the idea is to move to instead a virtuous cycle. So based on some of my own work, I find that optimists live longer, and optimism was better predictive of how long you live than, again, income was. Satisfied people are less likely to be unemployed. Trusting people were more compliant with containment policies. And that's it. So here, greater prosocial behavior, fewer deaths of despair, greater well-being, societal benefits. So let's invest in social capital, prosocial behavior, trust, and we'll get a win-win. That's it. Thank you. Sure. I can take questions if the fire alarm doesn't kick us out.
Thanks, Kelsey. That was really good. Could you say a little bit more about the situation in the U.S., however, especially in the last decade or so? Because my suspicion is deaths of despair were going up, but maybe you can show that they were not going up as fast as they would otherwise have been. Or is that the conclusion?
Yeah, so the U.S., I think, is a very specific case because it depends on the opioid crisis. And there it seems to be both kind of a demand and a supply side. So you have greater supply of opioids, and such that some of the pharmaceutical companies have actually been taken to court and prosecuted for, let's say, bad behavior in terms of marketing and increasing prescriptions when perhaps they shouldn't have, which have had knock-on effects. And then fentanyl is come in also in the last few years. So that seems to not be happening in other countries at the same level. And so that's the supply of the drugs that are killing people. And then there may be demand also. And so Carol Graham would talk a lot about this, and that's what our HOPE paper was looking at. You have despair, especially in countries that, in regions of the country that have kind of lost out to globalization and mechanization. And then it can also be these people who are forgetting my English, my only language right now. It's been a long day. The people who have dropped out of the labor force, and let's call it despair. And so it's really a different circumstance there. So it's both supply and demand happening in the U.S., and supply is a big part of what makes it U.S. different from other countries.
But the connection with prosocial behavior is still there? As far as
I know. So I haven't cross-referenced this, so it's an average effect. I would need to look at it specifically in the U.S. context, which we haven't done.
Thanks, super interesting. I'm wondering whether maybe by controlling for social support, you're not doing yourself a favor, because this could actually be a mediator of the relationship, and that could also explain why you only get the significant effect for donating money, but not for those two actions that are more related actually to social support in a more direct way.
Yep, it's a perfect point, and we tested for it. So the results are remarkably similar when including social support. So we just left social support in because it made through the main process, but we ran a robustness check dropping it. Yeah. Good, Raphael.
Thank you. I like the talk, and I think I'm inclined to believe your conclusions. But I had one objection came to my mind, which I actually don't think holds. But I wonder whether you have thought about it and maybe can test it in a way. We've seen that only donations have a significant effect. Could donations be seen as a proxy for available income beyond GDP? Because then basically this last variable of prosocial behavior would turn out not to be relevant in the way that we think.
Yeah, it's an interesting idea. So what we've done essentially to test for it is include GDP, but also poverty rates, and income inequality. So we haven't tested for that exactly. So I guess I'd have to think a little bit further about how we might be able to do that, to tease out that mechanism. But what we have done is controlled for GDP, and income inequality at simultaneously, and the poverty rate. So it should be mostly picked up. Catherine.
Thank you very much, Kelsey, for your presentation, which I really found very interesting, because moral injury I will deal with is kind of leads to despair. I was just wondering, because the data you gave us ended in 2019. In France, we have suicide data 3 years after. Today we get those from COVID-19, and what appeared last year was that suicide among young adults and even teens has risen in a very dramatic way, and so the figures will change. And we will need, of course, they could not do any kind of prosocial behavior at that time. However, it seems that this trend seems to go on, to keep on, in spite of the fact that teens have now come back to a usual kind of social behavior. So what do you think about that?
It's unquestionable that this later period is very different. So as you know, generally speaking, people in middle age tend to have lower life evaluations. And so people in early ages are happier. But the COVID-19 pandemic generally impacted the younger people more. I don't know off the top of my head the suicide statistics, but I wouldn't be surprised if it were consistent. At the same time, people were able to engage in prosocial behavior just as they were before. Frequently, you had young people who were, for example, delivering meals or shopping for older people. And it's consistent with the general story that they benefited even more than the people who received the meals. So it was well done. I think it was Christian Krekel who did part of the analysis on studying that that framework. So prosocial behavior was still a feasible outlet, but I don't know what it would look like in the most recent years. And, so many things changed that it would be worth writing another chapter on.
Thank you very much. It's extremely interesting, and plenty of data everywhere, and of models. It's very important to show this kind of thing. If you come back to your model earlier, there is another variable that is different to your main presentation here. That is perception of corruption. That is multi-star variable with a strong significance. After all, and you retain this, the model retains, your model retains this variable as a super important aspect. You have 2 stars everywhere. This means that it's really something. It's clear that in many countries on the planet, in the recent times, perception of corruption is increasing, not only in France, but it's elsewhere as well. It's something, it's different to your usual, to your present discussion, but it's something of interest in a period of declining trust in the system.
Short answer, completely agree. So I was a little surprised by how strong the relationship was, especially because we considered very closely related variables such as quality of governance. But it seems that people, if they feel like the system is broken, then it may be that it feels like they have very little agency to change their lives. because they're fighting against I think you understand. So it's a subject of future research. So the focus of this one was on prosocial behavior, and we'll probably write a couple of other papers looking at maybe corruption, as well as other variables. Probably
I think we should.
we're quite over, but if you have a question, feel free to come on up, and I'll stick around for a minute. Yeah, thank you again.
Thank you to Kelsey, to Alberto, and to John on the screen. One final round. Okay, that's it. Thank you very much. Hope you've had a good day. Go share some meals and come back up here.